There is no one particular surgical procedure for a fistula. There are many causes of fistula. Before operating a fistula, we need to diagnose the cause of fistula. And we need to do a detailed clinical examination, investigation, and then plan for treatment of fistula. Fistula is not about 30 minutes. Fistula is not about one day. It's life. You need to take it seriously, and it's a surgery. Any surgery results matter. In case you are suffering from a fistula, please consult the fistula specialist in your city, then go to him and go according to his advice. Many people come and ask us the recurrence. The average recurrence rate for fistula is about 30%. The best recurrences are about 15%. Our recurrence rates in the last 4 years, we started about 10 years back when we started with 15%. In the last 4 years, our recurrence rates are less than 3%. We will publish it soon. Why recurrence? 1. Fistula being operated by an inexperienced surgeon. Number 2. Fistula not diagnosed properly. Number 3. Fistula not scanned properly. Number 4. The cause of fistula may be a different cause, maybe a tuberculosis, maybe ulcerative colitis, maybe Crohn's disease, maybe any other disease. So the cause of fistula should be actually identified first to treat a fistula. Fistula is not all about laser surgery. It's not about 30 minutes. It's not about day care. It's all about getting the best result out of fistula. If there are 100 fistulas, you see all the 100 fistulas are different types. Fistula surgery has to be tailor-made for a particular fistula because fistulas are different in different individuals. So, whenever anybody has a fistula, please go to a specialist doctor who is experienced fistula. If you properly diagnose, find the cause, get a good scan, MRI or endoanal ultrasound, and then get operated by a fistula specialist surgeon, your recurrence will come down. Another very common question people come to us is the losing control over the stools, incontinence after fistula surgeries. Yes, we have seen many people coming with incontinence after a fistula surgery. Why incontinence after a fistula surgery? Because people go to quacks, people go to inexperienced surgeons where there are complex fistulas which are very deep. Surgeons operate without much experience. They may be good in other surgeries, but when it comes to fistulas, their experience is very less. They operate, they cut the sphincter muscles, and there is incontinence. Incontinence can be prevented 100% when you go to a specialist surgeon who is specialized only in colorectal surgeries, even in colorectal surgeries who is specialized in fistula surgeries. So, when you go to a specialist surgeon, your incontinence can be 0%. Please don't have the fear of incontinence when you go to a specialist surgeon. Thank you.